Good evening, this is Melissa Worthy with Class 104, Medication Administration. We have 4 meds to give today. So first thing I'm going to do is read off the orders for the 5 patients' rights. All right, so we're going to give, the patient name we're going to give to is Millie Larson. Her date of birth is 1/1/1936. All these meds are due now. The first med we're going to give is metoclopramide, 10 milligrams IV piggyback, and that's to manage her esophageal reflux. Next, we're going to give the hepatitis B vaccine, and that's just to protect her from against hepatitis infection. That's going to be given IM. The third med we're going to give is metformin, 500 milligrams tab, oral, to control her blood sugar. And the last med is going to be nitroglycerin patch, 0.4 milligrams per hour. That's going to be applied into one of the specified areas once we get in the room, and that's to manage her angina or chest pain. All right, so we're going to gather up these meds. All right, so the first med that we are going to get is the metoclopramide, which is 10 milligrams IV piggyback, and that is right here. We have metoclopramide at 10 milligrams in 2 mLs. We're going to drop the full 2 mLs for the 10 milligrams. The expiration date on here, I always forget to wear my glasses, is March 2027, so that's good. It's free of sediments and everything. So that's the one med. The next med we're going to get is the hepatitis B vaccine, and the hepatitis B vaccine is says hepatitis B vaccine, and we're going to give a one-time dose. So it says 1 dose on here for 1 milliliter. So we're going to pull up the full 1 milliliter, one dose. That's to be given IM. The expiration date on here is 2/28. All right. The next med that we're going to get is the metformin, 500 milligrams. You go to the medicine card, we got this. Metformin, 500 milligrams. The package is intact. The expiration date is October 10/23. And the last med from the med card we're going to get is nitroglycerin patch, 0.4 milligrams per hour. Every day, the expiration date is on here is 2024, and the package is intact. All right, so first thing I'm going to do is draw up, once again, the 10 milligrams of the IV piggyback. What I'm going to do is hand sanitize. I have all my supplies here. We have, because I know Millie Larson is slightly built, normally you want to use a 1 inch, 1.5 will be easy for her, since she's slightly built. It's 5/8 or 1 inch. And we have this syringe here, which is you want to at least use 23 to 25 gauge, and the expiration date is 11/30/2025, and we have at least a 1 cc or 3 cc syringe. Okay, draw this up. We want to open up the vial, clean off the top with this, right? Go down, draw up the 2 mLs. Let's just clean it off again. I didn't poke it in, but just to be sure. Go down, transfer the end, flip it over, and let it fill for 2 mLs. There we go. You want to recap. Place that down. You want to label. Name and dose, initial. Put that there. Put that down. The next we want to get is the hepatitis B, which is the 1 milliliters, right? Hepatitis B, right? Still 1 gauge, 1 inch IM. And we're going to give this in the deltoid muscle. While that dries, put this on. Draw up the 1 M. Puncture. Flip it over. Draw it back to 1 M. You want to label this the same way. Hepatitis B vaccine. 1 M. Initial. Okay, the next med is going to be the tablet, the metformin, 500 milligrams. Once again, we confirm 500 milligrams tab. We already confirmed the expiration date. We can just pop that in here. The next time, we already have the patches. Then we will go into the patient's room, and we will administer these meds. So first, I will knock on the door, and I'll say, good afternoon, my name is Melissa Worthy. I'll be your nurse today. We're going to be administering 4 meds for you today. But before we even get to the meds, can you verify your name for me? She tells me her name is Millie Larson. I say, can you verify your date of birth? She tells me her date of birth is 1/1/36. I said, can I see your wristband? She allows me to see the wristband, and I see and I verify that this is indeed Miss Millie Larson. All right, Miss Larson, you have 4 meds that the doctor wants you to get today. The first med is going to be given by your IV piggyback. It's called clopramide, 10 milligrams, and I'm just going to give you that via your IV, and that's for your acid reflux. Okay? Do you have any questions? She tells me no. All right. The next med I'm going to give you is the hepatitis. We spoke about that. That is to prevent hepatitis B infection. It's a series shot. You're going to get a total of 3 days. Your first dose. I will give you the handwritten material. Do you have any questions about that? She tells me no. The next med is the metformin. It is to control your blood sugar. It's 500 milligrams, which is in a tablet form, which we have here. Do you have any questions about that? Obviously, before giving this med, I will take her blood glucose sugar levels to make sure it is within range. And then I will retake it after 15 minutes or 30 minutes or so. The next med is a nitroglycerin patch, all right, which we have here, and that is for your chest pain, all right? Do you have any questions or concerns about the medicine I'm going to give you today? She tells me no. And just to be sure, do you have any allergies? And she tells me also no. All right, so the next I would do is confirm the meds that I have here. So Mrs. Larson, the first med that you're going to get, once again, is metoclopramide. We already drew this up. It says 10 milligrams right here. You're going to receive 2 mLs, because that's what we drew up. It came in that vial. All right, so hand hygiene. So she has an IV piggyback that's running. All right, the first thing I'm going to do is shut it off. Right, we have the alcohol pad here. We're going to take the site that's closest to here. We're going to clean it for at least 5 to 10 seconds. All right, you have any issues with the IV? It's been running fine. Those. I'll take a look at the site. The site is not ready. Doesn't have erythema. If I want to make sure that the blood is flowing, I'll just take the IV piggyback down to make sure I have red blood flow. Blood flow. Batch of blood coming back, and I do. So we know that it's working. The alcohol has dried. So now I'm going to administer the 10 milligrams. Going to unscrew the syringe, put that in the charge container. This is already clean. All right, I'm going to give it over a minute. All right, I'm going to manually clamp the piggyback side. I'm going to administer just a little bit. Then wait about 15 seconds. Give the rest of the dose. So a little bit more. Wait another 15 seconds. So far I've given half. Now I'm down to 3/4. I'm going to give a little bit more. Wait another 15 seconds. How's your day going so far, Mrs. Larson? She said she's doing well. Any issues, any pain while I'm pushing? No? Okay. After that 15 seconds, I'm going to give the last of here. And sure it's flowing. Wait another 15 seconds. All right. Dispose of that. Get a new alcohol, but just take a video. I can't get up. Get another one. Clean this. All right. Unclamp. Restart the IV. All right. Look and see if it's still patent. It is. She doesn't have any redness or anything like that. It has no damage from before, and it's still flowing properly. Do you have any issues? No. All right. The next med that we're going to give is the hepatitis B vaccine. So I'm just going to pick up what we've drawn up. It says hepatitis B, 1 milliliter, 1 dose. All right. And we're going to give this into the deltoid muscle. All right. What we're going to do is tell Miss Larson she's already sitting up in a sitting position. All right. I'm going to tell her just to relax. And you're going to feel a slight little pinch. It's where I'm going to administer the hepatitis B. I'm going to clean our deltoid muscle from the inside out. Right. All right. Leave that there to identify where at the point I want to poke. So I have the needle. All right. I'm going to release. Right. I'm going to pinch. Double up. I'm going to insert in this part within that middle of the bullseye that I've already created in my head within the deltoid muscle. I'm going to insert the needle. All right. Aspirate. No blood. And then I'm going to inject. Come out smoothly in one motion. Put on the safety cap. Done. Then I'm going to block or apply a band-aid if necessary. I'll tell her about what she should expect. Soreness or redness from this side, or even a little bit of swelling is normal. All right. Okay. Then the next med that I'm going to give is going to be the metformin. All right. It's 500 milligrams, which I already drew up. This is the only tab here. It's the metformin, 500 milligrams. She's already sitting up in the high follows position. I'm going to administer this with some water. She has water at her bedside. I'm going to stay and make sure she swallows. And give her the med. Her glucose was already checked. She swallows and drinks it with some water. And it's the 500 milligrams again, orally. All right. She has taken that. All right, the next med that we're going to give is the nitroglycerin patch, 0.4 milligrams. In the opposite arm that we've had we gave the hepatitis hepatitis B vaccine, we're going to give her the nitroglycerin patch, provided that that's not where the patch was before. All right, so we're going to make sure this is what we have. Yes, it is nitroglycerin, 0.4 milligrams per hour. And all right, going to make sure and clean the site. Make sure that the site doesn't have any excessive hair, wounds, or damage to the skin. Clean the site just the same way we clean for the hepatitis B, from inside to out. Let that area dry. All right, when we're taking out the patch, going to open. We want to label on the opposite side of the non-sticky side. So we're going to label time and date. Today is the 24th, 6/24th at 21:31, initials. All right. And just because I felt it's a good thing to, my arm is pretty much dry now, but I'm just going to change my glove again. And I'm going to apply the patch. I'll take off one of the sticky side and place it in the garbage. Then put that other sticky side on the spot, and then take it in one smooth transition, place it on the spot, smoothing it out and holding. There. Now, the other spots that I could have chose was either the shoulder, on the chest, or on the back. You want to make sure and not put it in the same place that it was before. You want to rotate the spots. All right, I'm going to clean my hands. All right, I make sure her coil bell is within reach. Do you have any questions, Mrs. Larson? Nope. All right. I'll be back in about a half an hour to check your glucose to make sure it's A-okay. Clean up any meds, and then I'm going to document, especially for the IMs, where I gave her the injection, where did I place the transdermal patch. Well, for the nitroglycerin, and the time and the locations for those. So this one was in the right deltoid, this one was on the left deltoid. And we have documented. And that concludes our medication administration.